Hi, Nick Sinclair. This is episode 1 of Skin and Its Contents. And here we are with the IBM Quantum System 1.
Yeah.
I'm here with Dr. Ed Reece, new chairman, Cleveland Clinic Plastic Surgery.
Yeah.
Welcome, Dr. Reece.
Thanks, Nick. It's great to be here on the first episode of Skin and Its Contents.
So, Dr. Reece, this is a bit of a homecoming for you.
Yeah.
You grew up here in Northeast Ohio, did your medical school at Case Western, and have been around a bit through Texas and Arizona. So how does it feel coming back to the Cleveland area?
It's coming home, literally, and feels that way as well.
Okay.
This is probably the greatest city that no one has known about. And in some ways, we like to keep that secret, but in other ways, we really want to get this out. So I really appreciate you asking me on today for this episode.
Of course. So let's delve into a little bit more about your trajectory and how you ended up in plastic surgery, what drew you to it. You did go to medical school down the street, as I mentioned, and did you go to medical school interested in plastic surgery? How did you find plastic surgery?
No, I was going to be a neurosurgeon. I thought for sure that neuroscience was my path, and we had an apprenticeship program in the first year of Case Western Medical School where you could shadow a surgeon, and there was a very famous neurosurgeon, pediatric neurosurgeon, who I was with here at the time at Rainbow Babies. And he was foolish enough to say, after a cranial vault, why don't you stay and see what the plastic surgeon does? And that's when I met Jeff Goldstein, who's now the chief of craniofacial surgery in Kansas. And I saw how he put together the skull. And it was really an aha moment. It was love at first sight for something that I really didn't have any idea about. I think that's what's amazing about plastic surgery. It's got many houses, and sometimes you stumble upon things that are so captivating. It changed my life that day.
Okay. Yeah. I do think it's one of those fields that nobody quite knows what we do. Even within the field, sometimes plastic surgeons aren't aware of what other plastic surgeons could be doing because it's such a broad field. And you alluded early on you were interested in neurosurgery. Now you kind of developed the spinal plastics field. So can you tell us a little bit about the history of spinal plastics and where you see it going?
I think it's my frustration of wanting to be a neurosurgeon but not being a neurosurgeon. It kind of came out of that or emulates that. I was working in Phoenix, Arizona at the Barrow Neurosurgical Institute, which was a very, very heavy spine and fundamental neurosurgery institute at the time. And I would be there till 11 o'clock at night, just closing very, very complicated redo spines. And there were a lot of very famous guys, which I didn't know were quite famous, but in fact they were. And it was when I was there to close a spine and I saw them taking a freeze-dried femur that was probably a foot long and putting it in the back, someone's back, and just wiring it into a cage. I think I was a little punch drunk from being tired, but I started mercilessly making fun of them. And I'm lucky they didn't throw me out. But I was just saying how this has no principle for it to work. And their response was, well, that's what we always do. And I said, well, then you like to do redos. Is this like an annuity or something? Is this how you're paying for your Lambo? And they said, okay, smart guy, well, what would you do? And I said, well, it required, it was long enough probably for a fibula, maybe 12 centimeters of bone requirement over this area that was really, had been operated on probably 4 times. And I said, well, I do free fibula. And they said, no, I've got 3 more cases that I want to get on. I'm not going to sacrifice 8 hours of my OR time, right? Because it's so precious. So I just off the cuff said, then I'll just do a vascularized bone from the iliac crest and take it and I'll keep it pedicle on the muscle. And that's what started it, because they said, they said, well, it sounds good. Has that been done? And I had no idea. One of the neurosurgeons there, who's the co-founder with me, Michael Boll, said, well, let's look at this. We went into the lab, and sure enough, it not only, it had been sort of touched on, but never really truly described. So we went down the whole spine and described ways you could help fuse spine where it needed to be fused for patients that were really hurting, and found ways that we could deliver them there. And then now, 10 years later, here we are, and we've done over 100 patients. There's probably 18 centers around the world that are now doing this. And so it's exciting because I'm really glad to be with the Neurological Institute here, working with them for spinal plastics. But thank you for asking. And I just want to say, that's really what makes plastic surgery special. To have a problem, to approach it in a creative way, and just to be impassioned about it. I think it speaks to all plastic surgeons, but to anyone that's even thinking about plastic surgery, that's what we're about. We're problem solvers, and we love to bring new solutions to things that either hadn't been thought of or thought of in a new way.
That was one of the lines of my personal statement applying to residency, was about being the problem-solving specialty. And I think it is true. And your story is a testament to, even after the field has been around, I think it's technically the oldest surgical specialty, plastic surgery, looking at old nasal reconstructions. And still, it's thousands of years later, and you're able to innovate within the field and describe surgeries in a whole subgenre of the specialty that hasn't been done yet. It's pretty remarkable.
Thank you. I still can't believe it. I understood the principles and understand the principles that make it work. It's every time I present it, there's some neurosurgery or spine chairman that says, "I wish I'd have thought of that." And sometimes it is the simplest things that really came from principles from hand surgery, which I had done for many years and still do, that sort of forged that whole process.
So those cases sound complex and multiple specialties and redos, as you mentioned. And these tend to be, I think, cases that utilize a lot of resources. And so how do you see kind of the plastic surgeon in that scenario, but also overall in these more salvage type scenarios, fitting in and bringing in specific value to the hospital, to the healthcare system, and how is that an important part of the healthcare system, having plastic surgeons available to help with these situations?
We're still relevant. In fact, I think that in a complex organization such as this, but even down to a community center, if you can extend what a care team is doing, whether it be orthopedics, any form of cancer care, any form of urology care, anything that requires going above and beyond, to have a plastic surgeon available is a game changer. And I think our consult surgeons would probably echo that. I've heard that many, many times. I think sometimes it's difficult to see the noise and the signal of what it is we're delivering, but it's so important and very much a part of being a surgeon, being a consultant surgeon to other surgeons, to not only get them out of difficulties, but really push the envelope of what they're doing. I mean, we're involved in so many things. First transplant was done by a plastic surgeon for kidney, free flaps, all sorts of things. And now spine, robotics, it's amazing. In many ways, we've taken fields like cosmetic surgery, aesthetic surgery, as you well know, and just pushed it to a level that it's enjoying what one might consider a golden era now, certainly from the standpoint of public knowledge, but very, very important from the standpoint of the hospital system as well.
So what do you think comes next?
Boy, the sky is the limit, in my opinion. We've recently done allografts, not xenografts yet, but human transplantation. We will soon be able to grow different parts, different muscles, nerves, tissue culture. So I think the plastic surgeon will become even more integrated in what we're doing in the future for what's going to sound like science fiction, certainly even 5 years ago. I think we were going to see that in our careers.
Yeah. The whole field sometimes sounds like science fiction. I think to outsiders, non-physicians especially, I took someone's leg and rebuilt their jaw with it. I took someone's leg and rebuilt their spine with it. It sounds like something a bit out of a movie, and which is one of the things that I think is so enticing about it, and so cool about it, is it's stuff that you'd almost ask a 5-year-old, how would you deal with this problem? And they would have this answer, but it sounds impossible, but plastic surgeons can do it.
We do it.
Yeah, it's pretty cool.
We do it every day, and we think about it. So it's a really great point. I think there must be a kernel of wonder in each plastic surgeon, that we are just the ones that ask what if, and then try to go after it. And through a lot of hard work and study and science, we've been able to in many ways change the world. And it shows in the public sphere too, because when you look at medical shows, they're either some sort of trauma in general or some sort of plastic surgery, even our foul ups, if you will, because everybody can see what we do at the end of the day. spinal plastics may be an exception, but aesthetic, everybody knows what you've done. You hope that they don't, but if it's done badly, they certainly know. Whereas if a transplant goes wrong, or transplant's even working for that matter, the patients are certainly grateful, but the public doesn't always understand what happened.
Mm-hmm.
In our field, we don't have that luxury, which is, it's a two-edged sword, isn't it?
Very much so. You when things go well, you get all the applause, and when they don't, everyone knows, and it
Right.
can be maybe not necessarily life-threatening, but disfiguring, and that has its own uniquely negative impact for people. So the stakes are high, and often not as much maybe in the spinal plastics, but in the aesthetic world and in other reconstructions, much of it is elective, and so you're taking people that are otherwise healthy and putting them through surgery, and so you need to. The stakes are quite high.
I think it's a great point, because not only are the stakes high, but we're really trying to affect their quality of life and even their perceived quality of life. So when you're doing that, it adds another vital sign, if you will, to the current vital signs. It's sort of self-perception or just function in general. And that's something that's almost unique, not totally unique to plastic surgery, but it's one thing that we really focus on. I would love to see a study on the fifth vital sign, patient perception and well-being before and after plastic surgery. And
it's become, that is, I think, becoming increasingly talked about with patient-reported outcome measurements and face Q and breast Q and these measurements that try to get at that. And you can do a surgery that you as a plastic surgeon are thrilled with. The nurses in the room are high-fiving you. Everyone thinks it looks great, but if the patient's not happy, it's not really a success.
It's a challenge. And then you're threatened to be on botched or something, right? So yeah, that's a fine line. But thank God for plastic surgery, as my former chairman Rod Rourke would say. Thank God for it, because we are going in that very gray area and trying to push the art and science forward on so many different fronts. It's really exciting. Yeah.
Well, it's an honor to have you here at Cleveland Clinic now, and I'm honored to have you here on the first episode. So thank you for joining us.
My pleasure. Thank you so much. This is great. I look forward to it. And we should mention System 1, which is for our first episode, our quantum computer here.
The ultimate problem solver.
Right. I wonder if it's problem solving us right now as we're speaking.
Thank you for joining us.
Thank you, Dick.